Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. Alzheimer's Awareness Month is coming up in November, but we're getting a head start on it with a discussion about this important topic and some of the ways the state of Illinois looks to assist people with Alzheimer's and their families and caregivers. We're pleased to welcome back to the show the Director of IDPH, Dr. Vohra, and a very special guest, Lieutenant Governor Juliana Stratton. Thank you both for being here. Director, I'd like to start with you to give us a quick explanation of what Alzheimer's disease is and what toll it takes on those who have it.
Well, Jim, thanks as always for having me on our podcast and really sort of bringing to the surface such a complicated and devastating disease, Alzheimer's, and many of the related disorders that when we speak of dementia, for those that have had loved ones struggle with dementia, we know that it's an illness that affects memory, thinking, behavior. And it is a progressive disease, meaning individuals will start with symptoms and they will grow often severe enough to interfere with daily tasks and really often a person's ability to care for themselves. 7 million Americans currently live with Alzheimer's. That number is expected to grow to 13 million by the year 2050, and it's already the fifth leading cause of death of persons age 65 and older. Early symptoms appear around for people the age 60, but the risk increases with age. And like many diseases, we know that there are disparities. Almost 2/3 of Americans with Alzheimer's are women. Older Black Americans are about twice as likely to have Alzheimer's or other dementias as older white individuals. And older Hispanic individuals are about 1.5 times as likely to have Alzheimer's or other dementias as older white individuals. And we know that Alzheimer's, as much of a physical toll that it takes on the body, it's often one that as the mind wanders, the mental health of individuals that struggle with Alzheimer's also grows. The ability slowly of individuals understanding, and sometimes even understanding that much more difficulty, how to cope, causing often a lot of depression and anxiety. And we know it's a big challenge on caregivers as well that we'll, I know, go into a little bit more detail on. And finally, I'll just say that it takes a huge financial toll. Healthcare and long-term care costs for persons with Alzheimer's is expected to total $360 billion this year alone and could rise to up to $1 trillion by 2050.
When people think about those kinds of stakes, a few questions come immediately to mind. Is Alzheimer's disease preventable? Is it treatable? And who's at most risk from it?
I'll just start by saying at this moment, there is no cure for Alzheimer's. But what we do know that there are treatments and treatments that are growing that can slow or change the progression of the disease, as well as a lot of drug and non-drug options that can alleviate symptoms. And more exciting novel research is coming so that we're learning more about this complicated disease and ways that we can reduce risk. And there's substantial evidence about ways that people can improve their chances by making lifestyle changes, remaining active, heart healthy. Other steps that can reduce the risk include managing diabetes, getting adequate sleep, and quitting smoking. And one point that I just want to elevate is that although people tend to see these symptoms emerge in their 60s, this kind of preventative stuff starts in your 30s, 40s, 50s to really take the kind of activities that can prevent this really debilitating disease.
We'd now like to once again welcome Illinois Lieutenant Governor Juliana Stratton to the conversation. Thank you again for joining us to talk about an issue that I know is personally important to you. So Please, if you would, Lieutenant Governor, tell us about your own personal experience with this illness in your own family.
Sure. Well, thanks for having me. What I would start with is just, there are so many people across the state of Illinois who are either living with this disease or caring for someone who is living with the disease, or they know someone who has been personally touched. And so one of the things I learned right off the bat in becoming Lieutenant Governor of the state and starting this journey was that I was not alone. And that's an important message to start with. My story was that my mom, Velma, lived with me for about 13 years. And in the last 3 years of her life, she was diagnosed with Alzheimer's-related dementia. And I was her primary caregiver. She lived with me. And we lost her in 2016. And I always say it was one of the hardest things that I ever did to care for my mom during that time. And it was also the greatest honor of my life to care for her despite all of the challenges. And so I know that there's a significant physical and emotional toll on both the person that's living with Alzheimer's as well as their caregivers. But like I said, it's something that if I had the opportunity, I would do it again in a heartbeat. But one of the things that really inspired me to take action was that in talking to other people who had the same story as I did, is that people did not always know how to access resources. They weren't always sure how to notice the signs. Hearing that it's a diagnosis of Alzheimer's can be very frightening. And I really wanted to just make sure that more Illinoisans were aware that their lieutenant governor had a similar experience and wanted to do something that would help families that were living with this disease.
And that leads us to something you started called the Through Our Eyes initiative. Tell me more about that and what you learned from it.
Yeah, so we started the Through Our Eyes initiative. I really thought of doing this initiative in honor of my mom, Velma, and it was very early on in the Pritzker-Stratton administration. We partnered with the Alzheimer's Association Illinois chapter and started with a 6-month listening tour because, like I said, there's such a sense that I must be the only one dealing with this. Caregiving is very lonely. You have to cut off a lot of the social interaction that you typically have. It is very stressful. You're not always sure where to get resources. And I know that was my personal experience. And I wanted to kind of tap into the wisdom that was found in other caregivers all around our state. So we kicked off a 6-month listening tour. We knew that there were lots of folks out there. In fact, according to the Alzheimer's Association Illinois chapter, there's over 250,000 people age 65 and over living with Alzheimer's in Illinois. And just as importantly, about 311,000 caregivers that are providing just over almost 500 million hours of unpaid care. As Dr. Vohra said, disproportionately women. I should also note that many caregivers also have their own chronic health conditions. And so what I heard as we started this initiative and this listening session, we just heard so many caregivers say, if only I had known sooner. If only we knew what we were seeing. I didn't know from my own mother. She lived with me, and what happened is she had to go over to, we sent her on a trip to visit her dear cousin in Florida. And when she came back, my aunt said, you know what's happening, right? And I said, I don't. She saw the signs, but I didn't, because she was a social worker and understood those signs. So I really wanted to really focus on education and the need for better education, awareness, and ultimately early detection.
And you worked on this not just to help families recognize these signs with their loved ones, but also to make sure that clinicians have the training to spot these warning signs and know when to start these sorts of interventions. Tell me about that effort.
Well, that really came about because of the Through Our Eyes initiative. After listening to so many families, and I went to different communities. I went to, suburban communities and communities in the city of Chicago. I went down to Redbud and to Springfield and to communities in central and southern Illinois. I went to predominantly Black communities and Latino communities, and I went to talked to young people who ended up leaving college, some of them, because they had to help care for their grandparents. And like I said, one of the key things that I heard was, I wish we knew. And so as a result of the Through Our Eyes initiative and working with the Alzheimer's Association Illinois chapter, legislation was passed where Illinois became the first state to require Alzheimer's training and to make sure that medical professionals who treat adults were trained in identifying the signs of Alzheimer's and other types of dementia. It really makes sure that healthcare professionals have the tools they need to help families and patients sooner. And let me just tell you from a very practical standpoint why that's so important, so that you can plan. As Dr. Vohra said, there's a financial toll. There were many times that I might go to work and then get called back home because I had to address an issue. You're not sleeping well. Lots of things are happening in the family dynamics. And if people knew earlier, they can start to get access to those resources. But when you get a diagnosis and you're farther along, you're kind of in reaction mode. And it was important to make sure families could be in a better position to plan. And you do that with early detection. And so doctors, nurses, social workers are now better equipped to recognize the warning signs and intervene earlier. And that can be life-changing for families.
You're listening to This is Public Health with the Illinois Department of Public Health as we're talking about Alzheimer's disease awareness. Our guest, Illinois Lieutenant Governor Juliana Stratton, and the Director of IDPH, Dr. Vohra. And Director, as Lieutenant Governor just referenced, the challenges that many families face when they are dealing with a loved one who has dementia. You referenced this earlier as well. So please, if you would, talk about the steps that IDPH has taken to help caregivers understand the skills they'll need to provide that care, something referred to as core competencies, and about the resources that are available to assist caregivers.
Well, thanks, Jim. And thank you, Lieutenant Governor, for telling the story of your mother, Velma, and both her inspiration to you and then the way that it could sort of create this meaningful change. You know, we spent a lot of time in public health and in our department talking about specific diseases, but as our audience knows on the This is Public Health podcast, so much of public health is about not just the people that are dealing with the disease, but how it affects families and how it really affects communities, public health being about communities. And so last year, we were really excited to launch a new program that was thinking about caregivers and dementia caregivers. And the program aims to educate, support, and connect dementia caregivers and their loved ones. We've partnered with 5 community-based organizations that are giving dementia caregivers, particularly in underserved Illinois communities, the tools that they need to provide care, the support they need to reduce their own stress, as the Lieutenant Governor mentioned, and the community connections needed to reduce barriers to care. Public health, but the health of communities is a team sport. It requires us bonding together to help because we know how much the personal toll is on the individual with the disease and the caregiver themselves, and really allowing us to sort of create those opportunities and connections. And you can learn more about this initiative at our website, dph.illinois.gov. Now, Illinois caregivers are important and need support. And so our Illinois Department on Aging also oversees the Family and Caregiver Resource Center that can help Illinois residents find the services that they need. And so want to also mention this important program and center from our Department on Aging partners. For more information on that, you can contact the Caregiver Resource Center near you by calling the senior helpline at 1-800-252-8966.
Of course, many families are caring for a loved one with dementia at home, but sometimes they need to turn to a long-term care facility or facility specializing in memory care to assist with that effort. Please, if you would, talk about some of the roles that IDPH plays in overseeing long-term care facilities to provide this kind of specialized care.
Wonderful. introduction, Jim. And I think one of the things that many people might not be fully aware of is that one of IDPH's offices is the Office of Healthcare Regulation. And we have a Bureau of Long-Term Care that's responsible for ensuring that long-term care facilities comply with applicable federal regulations, state statutes, and this includes facilities with Alzheimer, dementia, and memory care designations. Now, we license and inspect over 1,500 long-term care facilities, and we operate a 24/7 central complaint registry to serve the needs of individuals seeking to express concerns about the quality of care that's provided in that long-term care setting. Our department's committed to improving that quality of care and utilizing our enforcement actions to make sure that the people, and often are most vulnerable in long-term care settings, are being protected. And I just want to mention a little bit about some of the licensure designations for Alzheimer and dementia programs. And so these facilities must maintain appropriate staffing levels. Their staffers need to have work directly with Alzheimer's and dementia patients, and they have to have specialized training. And those facilities must promote things that every one of our residents should have: resident dignity, independence, individuality, privacy, and choice. A little bit of just additional information is that these Alzheimer facilities are required to provide appropriate care and level of service as well. And knowing that they need to have a full-time director that's educated and trained in these needs. So if you are having a loved one in one of those centers, please know, again, that IDPH is there to make sure that the people that you care about are being cared about well in that long-term care facility. We respect our long-term care partners in this task, and that our 24/7 complaint line is available for those residents who need it.
Lieutenant Governor Stratton, I'd like to turn to you for the last word here. With your personal experience, what's your message to families who may just be starting out on this journey?
One, I just want everyone to know across Illinois that Governor Fitzgerald focused on making the journey of diagnosis and treatment easier for families and easier for caregivers. And I want you to know that we see you and we stand with you. And you can see in the great leadership of Dr. Vohra that our Illinois Department of Public Health stands with you and is doing the great work as well to make sure you have what you need. Fighting dementia is a priority here in Illinois. You can see that reflected in our annual state budget, where we invest in Alzheimer's disease outreach, research, and care. That's important to note because a budget is a moral document. It reflects your values. And when we put money into the budget, it shows that that's important to us. But as important as funding is, I want families to also know that we also have to think about how to appreciate and show support for those who comfort those who have Alzheimer's and are caring for them. And so to our caregivers, I want to say, please know that when we pass policies such as becoming only the third state in the nation to guarantee paid leave, that's an example of our efforts to relieve the burden on caregivers who get worried that if I have to take off to help meet the needs of my loved ones, what will happen? Will I still have my job? And so that's an example of that. So the final word I would just say is, kind of where I started, and letting you know that you're not alone. You're not alone on this journey. You have a lieutenant governor who knows what it's like and who has walked, not in your exact shoes and similar shoes. I also want to just encourage you to seek support. I know that sometimes people would say, oh, can you do something for self-care? And you're thinking, when? I'm constantly busy. I'm constantly in that caregiving role. But you can't pour from an empty cup. So if you can, just find small little ways that you can fill that cup with something that brings you joy. And then finally, just remember that you only have the present. So take one day at a time, just one step at a time. I know it can feel overwhelming, but take a deep breath and know that there are resources that the state of Illinois is providing to make sure that this journey can be easier for you your loved one and your families.
Once again, I'd like to thank our guests, the Illinois Department of Public Health Director, Dr. Samir Vohra, and Illinois Lieutenant Governor Juliana Stratton. And thank you all for joining us here. Please join us next time for another edition of This is Public Health with the Illinois Department of Public Health.